Bone marrow transplant is a procedure used to treat a multitude of diseases through the process of replacing the blood-producing part of the bone with a better functioning part, called bone marrow. There are four major parts to a bone: the periosteum, a soft outer protective layer, then the cortical or hard bone that provides structural protection, cantle, a spongy layer that protects the innermost layer, the bone marrow. The bone marrow is a thick jelly-like substance that is found in large bones and is responsible for the creation of blood cells. There are two types of bone marrow, red and yellow. Red bone marrow produces mesenchymal stem cells that can become blood, tissue, and/or bone cells. Red bone marrow is what is used in bone marrow transplant and is found in the larger bones of the body, which are the pelvis, sternum, vertebrae, clavicle, and skull. Yellow bone marrow, on the other hand, surrounds the red bone marrow and stores lipids. Mesenchymal stem cells are just a branch of a slew of stem cells in the body. There are three main types of stem cells: totipotent, pluripotent, and multipotent. Totipotent stem cells have total potential to become any cell derived from the zygote, or when an egg and sperm join. Pluripotent stem cells do this also, and embryonic cells, found in embryos, stillborn children, and umbilical cords, are categorized under this also. Multipotent stem cells are mature cells and are limited to certain tasks. Through cellular differentiation, the process of making a multipotent stem cell into a specialized one, the adult multipotent stem cells produce three main types of blood cells in the bone marrow: red, white, and platelet blood cells. Blood cells are imperative to the overall functioning of the body. The lack of or malfunctioning of any category of blood cells will ultimately lead to increased extremities regarding disease. Red blood cells mainly circulate oxygen, and the lack of these causes malfunctions such as anemia and extreme weakness. White blood cells fight infection and create immunities towards other diseases. Without white blood cells, the body is more prone to infection and extremified symptoms of sickness follow. Platelets are healer cells that stop bleeding by creating blood clots in the body, and the lack of platelets will result in excessive bleeding or hemophilia. You may ask yourself, why bone marrow transplant? Unhealthy bone marrow will lead to the lack of or malfunctioning of blood cells in the body. Bone marrow transplant is a surgical procedure that replaces unhealthy, dysfunctioning, and/or destructive marrow with healthy marrow. It also helps cure diseases caused by bad bone marrow, such as, but not limiting to, leukemia and sickle cell anemia. It can also be used to aid the body in its recuperation after high dosages of chemotherapy and radiation. In addition, this procedure can also serve to prevent further damages from genetic disease processes, treat lymphomas, certain solid tumors, immunodeficiencies, as well as kidney cancers. Bone marrow transplant follows one general procedure, which requires donation through harvest followed by filtration and insertion. The general process is standard, with the harvesting of the bone marrow from the donor using a syringe with a needle going straight into the red bone marrow area of the donor's long bone, which is most commonly done on the pelvis or sternum, and a quart or more of bone marrow is extracted. The donated bone marrow is then processed in a lab using an instrument to separate layers by density: plasma, the liquid that suspends and allows red blood cells to be transported, peripheral blood mononuclear cells such as lymphocytes and monocytes, and the red bone marrow itself. Prior to transplant, the patient's bone marrow undergoes targeted weak amounts of chemotherapy and radiation to irradiate it and cleanly replace the bone marrow without contamination of the original. There are multiple types of donation forms depending on the patient's state of bone marrow and disease. In some cases, it is possible to use marrow from the same body. This self-donation of bone marrow is called autologous bone marrow transplant. It is only possible if the patient has healthy bone marrow in other parts of the body that has not been affected by their disease, weak immune system, and/or health overall. If this is not the case, there are other forms as well: syngeneic donation, which is from a patient's identical twin, if they had said twin. Another means of donation of bone marrow stem cells would be through the collection of embryonic stem cells from an infant's umbilical cord or a mother's placenta. This is called cord blood engraftment. Stem cells are frozen before they need to be used. This option is extremely efficient and poses little to no risk of transplantee host rejection, with a small risk of transplanting a genetic disease. But the controversy of using umbilical cords through harvesting cells derived from the embryo makes it extremely difficult to make possible. As both of these cases are quite rare, a more common means of bone marrow donation would be from a donor who shares the same genes as the transplantee, such as a sibling, parent, relative, or anyone else with a genetic matchup of at least 50%, also called an allogeneic donation. For example, as approximately half of one's DNA is derived from either parent, parents are ideal donors if no other relative has closer genes to match. Matches are determined through blood tests. Genetic matching is determined at the HLA or human leukocyte antigens genes level. Antigens are in toxins or any foreign substance that induces an immune response in the body, such as the production of antibodies. Human leukocyte antigens are proteins located on the surface of white blood cells and other tissues in the body, and the genetic matchup of the donor and transplantee depends on the body's major histocompatibility complex. MHC, which is a family of genes that dictates the creation of certain glycoproteins which are important to immune response. In each chromosome, there are a set of alleles called MHC haplotypes. In regards to humans, each allele for MHC is numbered. As all humans are heterozygous, each individual will have 2 MHC haplotypes, one from each parent for each chromosome. Each protein combination is different in each individual human, making every individual unique in their genetic makeup. For this reason, MHC molecules are polymorphic, which is when 2 genetic materials are present in one chromosomal population. MHC molecules receive antigens from inside the cells they are part of and projected on the exterior surface of their cell to be recognized by T cells to create immunities. Polymorphism varies at such a great extent that no 2 individuals are alike. This poses the case of matching HLA made up of MHC with donors and the transplantee, and tests are done to verify. It is extremely imperative that the donor and patient cells have a minimum of 50% matchup to avoid graft versus host disease, where the patient cells attack the foreign ones, which would be the donation in this case, and this is fatal. With this said, allogeneic donations are still extremely rare if they are unrelated. And of those, only 5 out of 10,000 international unrelated donors are matched, and of those unrelated donors, only 1 in 25 of the patients matched have a chance at actually going through with the transplant. Once the bone marrow transplant is finished, post-bone marrow transplant symptoms vary as the body's immune system fights to accept the body's new foreign cells introduced from the procedure. These symptoms persist until the patient's body heals itself and accepts the transplant, taking anywhere from a few days to multiple weeks. Although the post-procedure symptoms are not permanent, side effects of the procedure are conversely serious. These include kidney malfunction, susceptibility to infection, and excessive bleeding. To reduce the likelihood of these, many blood transfusions and sterile environments are suggested. In addition, graft versus host disease also poses a threat and is extremely life-threatening without proper treatment. Bone marrow transplant is a common procedure used to treat a multitude of diseases. Although the current process of matching potential donors to those in need is restrictively difficult, bone marrow transplants have an enormous potential for the patients of today as well as in the future.